Good afternoon, everybody. And my name is Deogratius Dyumurushi from United Republic of Tanzania. I'm going to present an evaluation of ethical use on knowledge, practice, and prevention of sexually transmitted infection among secondary school students. And in a nutshell, ethical application in knowledge, prevention, and practice for youth has an important impact, as a sexually transmitted infection is an illness that has a significant probability of transmission between human and animals by means of sexual contact. Sexually transmitted infection remains high in most of the world, despite the therapeutic advances that can cure most and render an individual to be non-infectious. WHO estimates that 1 million people are infected daily, and 60% of these infections occur in young people. Perhaps ethical application in services delivery has contributed to its spread, especially in younger population. Now, the objective of this study was to determine the extent of ethical application during knowledge delivery on prevention of sexually transmitted infections among secondary school students at Bishop Mpango Secondary School in Kibondo District in Tanzania. So the study population was conducted among secondary school students at Bishop Mpango, as I said, and the cross-section type of study was applied in this study. Questionnaire was used to collect information. The questionnaires were constructed and had both open and closed-ended questions. An informed consent was obtained from the individual students prior to questionnaire administration. Permission to conduct the study was asked from the district education officer and the school authority. Data were analyzed using computer SPSS. The major findings are that the health education, which is the backbone of the prevention, is not priority. The information or results disseminated to the relevant authority to be used for future planning and researchers. Well, the students studied were informed about sexual transmitted infections, its means of transmission, but not the method of prevention. And yet, they continued to have sessions about STI and reproductive health without the component of prevention of those diseases. Thus, informing and educating students about STI does not seem to be sufficient to motivate them to change their sexual behaviors, and attendance is very poor. They need more than education, especially in setting attractive services when they become sick. The result of this study revealed that 57.7% of the students studied, which were 157, attended any reproductive health session, which is risky to STI and AIDS. Always education among students is the only weapon in fighting STI, including HIV, followed by school televisions. To conclude, not all students have an access to radios and television. On the other hand, health workers was mentioned to be the least source of information at those schools. This might be due to incoordination between the health sector and the education levels that are in place. Now, The recommendation is divided at the level of national and the district and at the school and health facility themselves. Now, starting with a national level, the district medical officer, the DMOs, and the district education officer need to organize the further exploration of sectoral ethical application on the knowledge, behavior in a representative population of youth to find out, among others, which service could attract youth in reproductive health. Education promotion among sexually active youth should be strengthened through the coordinated effort between the district medical officer and district education officer to those schools. There is a need to do a study among secondary school teachers and the parents so as to get their views about education and information on STI in schools. At the school level and health facility level, local health personnel with the headmaster of the respective schools should think of establishing the information desk within the library to deliver sexual and reproductive health education, which is friendly and confidential. School management to stop asking for medical records for students who has attended at the health facility. This should be kept at the health facility, not at the school, to maintain confidentiality. Otherwise, this is the end of my presentation. Thank you very much. Welcome for questions, addition, subtraction. Thank you very much. That is the end.